Hi, my name is Nick Krizmarzik, and today I'm going to be telling you about your new Novolog insulin pen for type 2 diabetes. So, first I'm going to tell you how to use it correctly. So, you'll want to wash off your hands before every use to make sure that you get all the bacteria off. And then you'll need to pull off the pen cap. And so you just pull off the pen cap, and then there'll be a rubber stopper on the bottom. So you take a alcohol swab, and then you rub off the top of the rubber stopper, so there's no bacteria on that. And then you take a disposable needle that comes with the Novolog pen, and there's actually two caps on that. So you screw it on the pen first, and then when you're ready, you take off both of the caps, and then you'll want to watch out because you don't want to prick yourself because you may get an infection, and obviously it may hurt. It's never good to prick yourself. So make sure you're ready when you take off both of those caps. So you took off both those caps, and now you have the pen, and then you have the needle on top. So what you need to do next is you need to turn the dose selector to 2 units of insulin, and then you want to tilt it 90 degrees, and this is called an air shot. So what you do is you need to tilt it up, and then press on the hard push button on the bottom, and get all the air out until the dose selector goes to 2 or goes to 0 from 2, and then you'll have all the air out of it. And there may be a little drop of insulin on top, but that's fine. It won't mess with your dose or anything. That's just to make sure all of the air is out so it doesn't get in your bloodstream. So next you want to select your dose. So to select your dose, it should always start at 0, the dose selector. But then you need to know what your insulin to carbohydrate ratio is in order to know how many doses you are going to take before the meal you are about to eat, because that's when you need to inject your insulin. So insulin to carbohydrate ratios are the ratios that a single unit of insulin covers for how many grams of carbohydrates. So different types of ratios are, if you weigh maybe around 60 pounds, it could be a one unit of insulin to 30 grams of carbohydrates. But if you weigh more, if you have a higher tolerance to insulin, then you may have like a 1 to 10, 1 to 5 insulin ratio. So you want to make sure that you know what dose you want to take, because if you take the wrong dose, you could get hypoglycemia, which I'll talk to you about in a few minutes. So taking the injection, actually. So what you need to do is you need to push the needle against your skin, and then you'll press down on the push button all the way until the dose selector turns to 0. So then you have all of the insulin in, and you want to make sure you keep on pushing on the button, and you want to until you pull out of the skin. And you should keep it in your arm for probably about 6 seconds or so. And when you pull it off, there may be a little thing of insulin on the top of the needle, but don't worry about that. That won't affect your dosaging at all. So if any blood appears from the site also, you'll want to just cover it, apply pressure to it, and then put a Band-Aid over it just to prevent infection. But after you have injected your insulin, to dispose of the needle, you need to get a little plastic or hard container that has a top on it, and put your needles in there, and then you can talk to your medical provider about how to dispose of those needles. So then there's a few concerns with taking insulin. The first one, which I mentioned earlier, was hypoglycemia, which is low blood sugar. So this can happen if you overdose on insulin. So your blood sugar will dip way down, and then some of the symptoms that go with it are you might feel weak, you might feel drowsy or dizzy, you might experience shakiness, confusion, anxiety, nausea, headache, blurred vision, or sometimes a loss of consciousness. So if you start to feel any of these symptoms, what you want to do is you want to start you can check your BG, check your blood sugars, make sure it's all good, and then you'll want to sip on a sugary drink to try to get those blood sugar levels up. So next, different side effect kind of insulin may be weight gain. So insulin promotes the storage of fats, and therefore it's oftentimes that insulin or diabetic patients gain weight. So if you are trying to lose that weight, or if you want to try to keep it down, you can see a dietitian for that. Next, if you're taking multiple medications, there may be a opportunity for bad drug interactions that may have bad side effects. So you want to talk to your doctor about that as well. And then some general side effects of insulin are anxiety, confusion, dizziness, and if you get a rash on your injection site, you want to make sure that you go see your medical provider for that as well, because that can be very bad, and if you that can often happen if you use disposable needles, so you multiple times. So you want to make sure to keep an eye on your injection sites as well. Thank you for listening.